guys are doing a great thing. It's such a uncomfortable topic to talk about, especially for a guy, young guys in their early 20s. And, I'm glad that, I could tune in and, listen to you guys.
Spencer Kobren's The Bald Truth.
Hey guys, welcome to the broadcast. 888-659-3727 is the toll-free number. I think the phone lines are working. I was having some trouble with them. I think it's just maybe something has to be reset, but I did try to call in, so the lights do light up. So call us at 888-659-3727. This is the Hair Loss Show. Been doing this broadcast for close to 30 years, since 1998. In 3 years, I make 30 years.
Wow.
Sitting behind this microphone or a microphone of some sort. Either during the program.
For many years, that actual microphone.
And for many years, this actual microphone.
Yeah.
I think I'm one of the few guys out there that uses an RE20. I know that Tim Dillon decided to use an RE20, which is interesting because he comes from that podcasting universe where everyone uses, the Shure mics.
Yeah. They sure do.
Yeah. But yeah, you're using one. But when I started in this game, I was actually doing the radio show from my home studio for a while. So it was like 2 years. Didn't have to go to about a year and a half. Didn't have to go to Westwood One. I'm like, you know what? I'm just going to build the studio in the house, make that happen. So this equipment is ancient. So if we have problems with it, forgive me. What am I going to do? I guess I can invest in new stuff, but I'd like the whole it's like an ancient radio museum.
There's so many ways I could go with that one.
Yeah. Well, besides me being 60.
There's a museum piece behind the desk.
Yeah. 888-659-3727 is a toll-free number. Thank you guys so much for hanging on and calling in. We do have calls on the line, but I know that Joe really wanted to talk about PP405, which is getting a lot of press recently. Mm-hmm. We can talk about why it's getting press, the reason behind that press, and also, obviously, for those who don't understand what this pretty novel topical approach is, we can talk about that. But you know what? A lot of these kids don't understand how to hold on, especially when you do an opening now, like the old days. So maybe we'll take a call and then get into it.
Let's do that. Let's take a call.
All right. Hey, you're on the air. Who's this and where are you calling from? Hey, caller.
Hello?
Yes.
Am I there?
Hello?
You are on the air. What's happening, brother?
Hi. Hi, I'm Thomas calling from Boston.
Hey, Thomas.
Hey,
welcome.
What's up, Thomas?
Thanks. I was wondering, so I've recently moved from Europe, and I'm running out of the Avodart I brought with me. And as I'm sure you know, it's at least $300 a month here. And I know also that you guys recommend Tiva, and I was trying to get a hold of that, but I couldn't. I called different pharmacies, and they didn't have it, and I called an independent pharmacy, and they couldn't track it down with their suppliers. So I wonder if you guys have...
Don't you have any friends in Europe who, and your doctor who can write the script and send it to you?
What do you mean? You mean mail it from Europe? Dutasteride, Avodart?
Yeah, I don't think that's. I mean, I could be wrong, but I don't think that's illegal. Is it, Joe?
It's illegal
to ship it from Europe
Yeah.
Yeah, not on a professional basis.
I don't know the European regulations.
All right. Well,
I think it is. I think it is illegal, but
don't break the law.
You can't get it through customs.
Oh, you can't get it through customs. I didn't know that.
You can bring, if you're traveling, you can bring up to 3 months supply with you at a time. Is the rule.
Why don't you just hire a mule?
Hire a mule. Yeah, or fly to Europe. But at that point, it's almost cheaper to fork over the $300.
Yeah.
Thomas, have you looked online on Tiva's website to see where they work, where they offer their products out of?
No, I haven't.
Yeah, that's your first step. Like, I don't know who sells it. And I want to clarify. Like, I don't recommend quote unquote Tiva. I just know that like patients I've dealt with that have been using it seem to have had no problems with efficacy on the products. Yeah, and that was with finasteride too, by the way. I've never known of any patients to have a Tiva manufactured dutasteride generic. Not saying there's anything wrong with it or great with it. I don't know, but I just want to make that clear so that anyone else hearing this isn't saying, oh, Tillman and Kobren are recommending a specific generic. We're not. But if you're trying to find a specific generic like Tiva, I would recommend going to their website and see if they have any resources on how you can find their products.
Okay.
And Graham, just to let you, Graham in the chat room, it's a Mac. It's an old school Mackie 1604, which is like ancient, and it's jerry rigged for radio with a little apparatus that was made so that I could have monitors in here and turn off the sound and have it in my headset and have the sound come through monitors. Sorry, man. Graham asked me a question, technical question. So, yeah, man, I mean, I think what Joe said is absolutely right. We're not necessarily recommending specific generics for specific drugs. This happens to be a company that makes, legit generics and has a really good track record. So, and I mean, let me ask you a question. I mean, for a short period of time until you can find something, or even for a long period of time, I mean, it's $300 a month to continue to keep your hair. Does that cause you a lot of damage financially?
No, I could.
Yeah.
Yeah.
So my thing is, if it doesn't affect you at all, and you've been on it for a long time doing well, why even switch to a generic? If you could afford it, no problem. Why not just buy it?
Yeah.
Okay. And,
not that you have to.
No, you don't have to. I'm just asking.
Yeah. Yeah. No, it's just it adds up to over the long run.
Like there's other ways to save money, like cut down on your on your phone plan, or maybe don't drink as much. Go out to dinner.
On Tello, so.
What'd you say?
I'm already on Tello, as cheap as it gets.
Well,
but no, that's okay. Do you have you heard anything positive or negative about Camber?
The generics?
Yeah.
I don't know much about it. Nothing negative directly. But here's the thing. I would say the vast majority of people who switch a couple of times on their generics. Now, they may get away with switching once. But the guys that have switched multiple generics or have been switched, it seems like they always lose ground. That's when they panic. That's when they think finasteride or dutasteride is no longer working for them. So
lose ground temporarily, or
well, normally if you're going to lose ground on it, it's not as though you're just going to go through an effluvium and then you're going to catch up. For whatever reason, that particular molecular formulation with fillers, whatever it is, isn't as effective for these people than when they were on either a name brand or a different generic.
Okay.
So my whole thing is, if it ain't broke, don't fix it. If you could afford $300 a month, I mean, would you be, if you got a good generic, even if it's a good name, and it didn't work for you, would you be kicking yourself for saving that money?
Yeah, probably.
Yeah, so that's how you have to think.
Okay.
Well said.
And another note, do you guys have an opinion on Dr. Jean Devroy in Belgium?
Yeah, on a personal note, I don't really like the guy that much. However, I think he's been good at what he does for a very long time.
Yeah.
I think he's benefited a lot of patients. I was a little, there was a story that came out, and I hate to talk about this because I don't want to. It's not necessarily his fault, obviously. But there's a story that came out about a young guy, French kid, who flew to Turkey to get a beard transplant that kind of went south. And he went early on to see Dr. Devoy, and to have a consultation. And the doc didn't really hold back about the possibility of what's happened to him. You froze, Joe. And,
Great.
Instead of saying, well, you know what? These are early days. Maybe this is correctable. Let's see how it grows out. Maybe the beard can be trained eventually. Let's just wait and see. At least according to the stories that were put out there, he said directly to the patient and to the patient's father, allegedly, that a lot of these grafts didn't even grow. They're all in the wrong direction. I mean, and this may not be verbatim, but this is what I read. And that this is going to be a very difficult case to repair. Now, I can understand and appreciate the honesty, but there's ways to be honest and ways to be delicate about something like this. Unfortunately, a few months later, or I don't know how much longer, this kid ended up killing himself because he felt he had no hope. When, in fact, I believe if he allowed that beard to grow out, it's very possible that it may not have looked great, perfect, but it could have been trained. He could have used certain oils, maybe some styling products to eventually train it to the point where it wasn't standing in a out perpendicular fashion. So my point in saying that is, I don't know if this guy has the best bedside manner or the best judgment as far as talking to patients, but he's good at what he does. And to my knowledge, he's always on top of his staff. He invented a very important device in the field called the WA system, which is it the WA? Yeah.
Yeah. Yeah. WAW.
Yeah. Which a lot of
FUE extraction tool.
Yeah. A lot of doctors really like that tool. So, he's good at what he does.
Then he had his ass sewed off for the design of the punch. That basically changed FUE as we know it.
Yeah.
And sorry to cut in, but my opinion of the guy, I've always thought he was arrogant, more arrogant than he should be. Never had any sort of personal issue with him, but just from observation and observation.
And he smells like smoke.
Does he?
Yeah. Anyway.
He what?
But
smells like smoke.
He smells like smoke.
Or used to.
But I have to acknowledge the contribution he's given to the industry, which wasn't surgical so much as it was surgical equipment, and that was the development of this motorized FUE tool and the punch that went along with it, which really did change the game. That system was used on myself on my last surgery 6 years ago, and it really was a great approach that changed the surgery for so many clinics. So,
okay.
Anyway, how's my hair look, by the way?
Outstanding.
I was talking to
Thomas?
the caller. Listen,
How's his hair look?
Thomas, I really wish you the best of luck. Again, listen, I tell the truth about, and so does Joe, about the personalities of these doctors and how we feel about them as people, but that doesn't take away a level of a skill set that these guys have and his contributions to the field. So, I mean, if you were decide to get some work done with him, if you're a candidate, I think you would be in good hands.
Okay, thanks. Your hair looks good, by the way.
Thank you.
I don't know what you bitch about all the time.
No, I just tried a new shampoo and it was like a whole thing. Like I was like really taking the blow dryer to make it as full as possible. So
that's good.
Listen, Joe, you're frozen. I don't know what to tell you. I mean, it's a nice pose.
Shit. Thank you. It's my good side.
Yeah. So, caller, anything else I can help you with?
That's everything. Thanks.
All right, brother. Listen, good luck, all right? Let us know if you find the detached ride you want or if you decide to stick with it.
Yeah.
All right. Take care.
Okay.
All right, guys. The phone number is 888-659-3727. It is, Adrian, it is a very sad story. And, there's a way to deal with people. I know that our doctor friend in Atlanta doesn't necessarily deal with people, and I would say the most use the best judgment in dealing with people's feelings or have any real empathy when he's speaking to people. And you have to understand, especially a kid who's in that position who decided to make a really huge mistake in his life. He's already feeling very vulnerable, and he's already depressed about the situation. He's going in for a second opinion, or at least in hopes of being repaired or being helped. You got to give the kid hope. You got to take a look at his mental status, really see who you're talking to, and at least offer the kid hope, even if it's slightly false hope. It was so early on in the process that it may have given him a chance to get some help, for the psychological damage that this was doing to him, and maybe it wouldn't have been so knee jerk. And maybe he could have just come to visit and contact the doctor and maybe, ask questions along the way. And, sometimes you have to do a little hand-holding with these people. I have known people who were literally stated they were suicidal. And with a little bit of hand-holding, they'd contact me 20 years later saying that they were able to get over things. The conversation changed their lives. In some cases, it was multiple conversations. I mean, I don't understand these guys. Yeah, it's great.
Well,
don't go to Turkey. There's a lot of bad work being done. You don't need to say that shit when a kid is already fucked up.
Yeah. So what's done is done, and no amount of slamming the decision is going to change anything. And I've seen it before. And honestly, I mean, it's easy to kind of forget what you're dealing with, because I remember seeing cases coming in back when I worked in clinic, and just horrific jobs that need to be repaired, and I found myself catching myself, because you got to be cognizant that it's on someone's head.
Yeah,
and it's no different than calling them out on the street, like, for wearing a wig or something. It's like you just don't do that, right? And there's a certain finesse that you got to have.
Worse,
you can acknowledge that it's bad.
It's
but
worse.
You don't have to.
The wig. He could take the wig off. These guys are disfigured.
I'm talking about the calling out thing, like the initial shock of being called out like that. That's pretty bad, regardless of being able to take it off or not. But the point being is that, you got to have some finesse with it. You can still acknowledge that it's bad without making someone feel like they should.
I'm called out all the time, and it's not even a wig.
It's not even a wig. You can't take it off.
Think about that. I have to live with this.
How does it make you guys feel?
Fucks. These
Fuck.
these punks. 888-659-3727. Okay, so let's talk about the hype. It's funny. My little nephew, he's not that little anymore, texted me about it and asked me my thoughts on it. It was on my birthday, by the way. Yeah, he texted me on my birthday, asked me my thoughts on it, and I told him. And
so he texted you on your birthday.
Didn't even get a happy birthday from the kid.
Exactly.
Yeah.
And I have to, ungrateful.
No, honestly, I have to laugh about that, because I didn't know when my uncle's birthday was. Any of my uncle, I had no clue.
Yeah, I was probably the same way.
I had an uncle. He owned a shoe store for many years. He's supposed to be my closest uncle, my closest uncle, or the closest brother to my dad.
Yeah.
I remember one day he came over. He brought me a pair of, I don't even know if they were legit Pro Keds. They looked a little off. Got me a pair of Pro Keds. And I remember my father was on the balls of his ass. We had to get, we were getting hand-me-down clothes at the time. Gives me some Pro Keds. Guy owned the shoe store. Yeah. And for years, I'm talking about until I was in my 20s or so, he would bring up those damn shoes.
I thought you were going to say you kept wearing them.
Yeah.
A little tight there the last few years.
I was like, Uncle Blank, you own the fucking shoe store. You could have given us shoes once a year, maybe.
Exactly. I was going to say.
Yeah.
Just one set of Pro Keds. Why not one set a year?
Holy shit. He played marbles with me once, and he wouldn't let me forget about it.
Yeah, he's got issues.
Yeah. No, he's all right, though. Let him rest in peace. He was all right guy. Anyway, so yeah, PP405, we can talk about it. We can talk about all the hype around it.
Yep.
We can talk about kind of like the new recent press that's been really, like every so-called influencer is really trying to get a lot of clicks off of this shit. And it makes me laugh because, it makes me laugh because this is stuff that's been around since 2017. It's nothing new. And it's research that's been conducted. It's exciting in a sense because it is a novel approach to, to treating this devastating disease of the spirit. But anyway, I'll let Joe take it from here.
Let me read about it. So I'll go. I'm going to read this because a lot of the viewers and listeners may not have heard of what this is. So bear with me on this. PP405, it's a topical small molecule developed by Pelage Pharmaceuticals, which is a company spun out of UCLA. And Spencer and I were talking about this off air before the show. Aimed at treating hair loss by targeting the metabolic processes of hair follicle stem cells. How many times have we heard stem cells in the past 10 years?
Yeah.
I mean, it doesn't mean anything to me anymore. It's just such a worn out phrase, but I mean, it is what it is, right? Designed to address androgenic alopecia, as well as other forms like chemotherapy-induced and stress-induced hair loss, such as telogen effluvium. Not sure how. Anyway, molecule works by inhibiting the mitochondrial pyruvate carrier (MPC), which shifts the metabolism of stem cells by upregulating lactose dehydrogenase or LDH. This metabolic shift mimics the natural process seen during intense physical activity, which is interesting, where lactate builds up, triggering glycolysis, prompting dormant hair follicle stem cells to wake up, quote unquote, and enter a growth phase, leading to production of terminal thick hair rather than the fine peach fuzz often seen with other treatments. I never got hair growth from working out hard. I don't know where that's coming from. Get it? Anyway,
Yeah.
Research on PP405 began over 10 years ago at UCLA, so more than 2017, with the first human trial starting in 2023. Phase 1 trials completed early last year in 2024 demonstrated that PP405 is safe and well tolerated. Okay, that's good. With no detectable systemic absorption in the blood, meaning minimal risk of side effects like those seen with hormonal treatments such as finasteride. The trial showed a statistically significant, and that's an important phrase that you need to look for, statistically significant or insignificant, because that does mean a lot. Statistically significant increase in K167, which is a marker of cell proliferation, within 7 days of a topical application daily. This indicates active engagement of the hair follicle stem cells. Biopsies also revealed structural changes in the follicles, shifting from a resting telogen phase to a growth or anagen phase. The dosing regimen was optimized to once daily, as twice daily applications showed no additional benefit. That's interesting. And it's nice because, like, I hated the idea of Rogaine early on because twice a day. Who the hell has time for that? By mid last year, 2024, Pelage Pharmaceuticals initiated phase 2A trials enrolling 60 men and women with androgenic alopecia to further evaluate safety and efficacy. The trial is inclusive, recruiting patients of all skin phototypes and hair types, a departure of from many historical hair loss studies that often focus on more homogeneous groups. The study involves daily application of PP405 or placebo, with results expected later in 2025. Pelage has raised significant funding, $16.75 million in Series A funding or financing, and then in February 2024, and then followed by $14 million in Series A1 funding, led by Google Ventures, just recently in August 2024, to support the trials. A clinical advisory board, including dermatology experts like Matthew Avram and Arash Mostagimi, was formed to guide the clinical program. Those guys are pretty big in this space. PP405's potential lies in its non-invasive, hormone-free approach. I can agree with that. which sets it apart from existing treatments like minoxidil and finasteride that often have limited efficacy, side effects, or merely slow hair loss rather than promote regrowth. Very true. Early data suggests it could stimulate robust hair across diverse demographics, potentially revolutionizing the hair loss treatment landscape, which currently is valued at $2.22 billion, excluding pharmaceuticals and surgeries.
Isn't that wild?
That's it. That is wild. That's an interesting number. Researchers are optimistic about, with some estimating that if trials succeed, PP405 based treatments could hit the market between. Anyone venture to guess? How far out are we from seeing PP405 based treatments?
I would say, what year is it? 2025? Maybe 2031.
That's pessimistic. They're optimistic. Between 2027 and 2030, pending FDA approval. I don't think it'll be that soon. I agree with you. At least 2031. However, scientists caution that no treatment works for everyone, and larger trials are needed to confirm efficacy and long-term safety. Now, the mechanism of PP405 draws parallels to metabolic shifts in muscles during exercise. This is the interesting part for me anywhere, where lactate accumulation drives energy production via glycolysis. A 2017 study in Nature Cell Biology supports this concept, showing that increasing lactate dehydrogenase activity can reactivate stem cells for hair regrowth. PP405 leverages this by forcing hair follicle stem cells into a similar metabolic go mode. First time I've heard that in hair. Transitioning them from dormancy to active regeneration. This approach could complement other therapies as its mechanism is distinct from hormonal or growth factor-based treatments like PRP or exosomes. Despite the promise, some skepticism exists as many hair loss treatments historically fail in later stage trials. Absolutely. And the road to regulatory approval remains challenging. That is a summary about PP405 up to date. Now, I did tag in my Instagram post announcing the show today, I did tag Hair Loss Cure 2020. He's usually in the chat room. I don't see him today, but hopefully he might chime in. I would love it if he calls to talk about this.
Well, I'm going to give you my perspective, and let's start with the positives. This guy, Marco Young, spelled J-U-N-G, I think.
J-U-N-G, yeah.
He is
Korean.
already behind a blockbuster prostate cancer drug. Mm-hmm. So the one reason, in my view, first of all, Google's not going to get into anything unless they know they have a real closer in the ninth inning. And they already have a closer. They have a guy that developed a multi-billion-dollar drug at UCLA. So this guy's already got some serious legs. That's unusual. We don't see that in this game. It was, while it's a hormonal-based drug, it's still kind of like a line. He was able to pivot, his initial concepts to this technology, which I think is really fascinating. So that is exciting to me, and that's why I think one of the main reasons Google is helping to back it and raise funds for it. What people don't understand is this pharmaceutical company really was just developed as an offshoot of UCLA. Any intellectual property that's discovered at a university is owned by that university. Now, what does that mean, and how does this affect the drug, and how does it affect it actually coming to market, and how does it affect the reality of the press releases and all the happy horseshit we see about it? When UCLA partners with a company and develops a drug with a company, they get a pretty big percentage on the back end, and also there may be some money coming in from venture capital. So it is in their best interest to raise as much awareness, to get as much clickbait, to get as much press as possible. And if it comes out of a university, it's a lot easier than if it's just a privately held company, which essentially they're partnering with. The founders of this company are active researchers and currently being paid, to my knowledge, by UCLA as well. So there's an interesting correlation. That's also why, again, you're going to see so much press. They have to keep their labs going. So any, movement they're going to be discussing, whether it's they get venture capital, which, again, very exciting. This guy, Michael Young, already came to the table with something huge, and that's why I think Google Ventures has gotten behind him. And that's why I'm pretty positive about it. I think that this may be legitimate, but these timelines could be severely, significantly protracted. Why did I emphasize protracted? And, my nephew contacted me, who's like 23, going to be 24, I think, and asked me about it. And I'm like, yeah, maybe by the time you're 30, we might see either this or something similar to it. But I wouldn't hold your breath at this point. Doesn't mean that this isn't legitimate. Doesn't mean it's not exciting. But, there's a process that goes on as far as getting attention for these products. Google also wants more attention. And the fact that these press releases and these influencers are really getting a lot of visibility might have to do with Google as well. They're pushing these things out in the algorithm.
Well, a lot of people out there are saying, well, if Google's involved, there must be something to it.
Absolutely.
So it's kind of a self-perpetuating, self-influencing, I guess. You could auto-influencing.
Look, the bottom line is this is a novel mechanism. You got top-tier researchers behind it. You have a top-tier researcher that has already made and contributed to a multi-billion-dollar drug. So that's all positive to me. I mean, I think that this is, out of everything we're seeing currently, this is one of the most, there's maybe two others, legit possibilities to really help to manage this curse. And my hope is that in 5 or 10 years that this is not going to be a thing for people. That, all right, let's slap this shit on your head. It's going to be a pain in the ass, but at least you're going to be able to continue to keep your hair, and you're not going to have to affect your hormones in any way.
I find it more interesting today than I ever have, because one, we've never had legitimate new types of therapies getting into stage 2 trials.
I've got to stop this. This guy in the chat just writes, "What about PP405?"
No, he says PP406.
Oh, 406. Oh, you know what?
Yeah, it's even better.
I am 60 now, and my eyes are going a little bit. Go ahead.
That's good. But I'm more excited now than I've said this many times on the show and various outlets that this shit bores the hell out of me. Like, it bores the hell out of me only because I know it's all just BS. Like you said, there's the promotion, there's the buildup of it just to get eyeballs and clicks and investments and stuff, and it never ever amounts to anything. Well, but we're still there. But we're still at that point.
But I think it's important for people to understand. I'm sorry to cut you off. Go ahead. Finish your thought.
But we are in a position where it is more exciting to me because there's more options out, more pathways to new treatments that are being investigated that are reaping results. It's just they haven't gotten to the point where they got actual humans with quantifiable improvement. But there's some others out there right now that aren't on my mind that I'm going to be talking about probably next week that, in my opinion, are even more impressive than what we got going on here with PP405.
Well, I think we'll see. One of the key takeaways here, and that people really need to understand when they get excited about this and when they see all the influencers jumping on this to get clicks, all this media hype is always investor-driven. It's not timeline-driven. It's not success-driven. It's investor-driven. Now, that's not necessarily a bad thing if you understand the process and you just want to get some information, and it's kind of, they're able to keep this stuff out in the in the ether. But is that the right word? But everyone, I understand why Reddit and all these different websites are able to get a lot of visibility based on people spending so much time discussing these treatments. But I promise you guys, you're not going to find out any more information about these treatments by going to the message forums or reading about them on Reddit. because it doesn't exist. These people who are on these platforms don't know shit about this. It's all speculation. You know, my excitement is this guy he's already a real closer, not the typical or one of the guys that are involved, not the typical researcher that's connected to a university that we've been hearing about for 20 or 30 years that just keeps pushing for grants and never really comes up with anything. This guy developed and helped to develop a multi-billion-dollar drug for prostate cancer. He's already in the game. That, in my opinion, is why Google Ventures have decided to, help to get them venture capital. They already see a winner. I would too. I'm looking at this a lot more closely because I know this to be reality.
I'm just curious if they invested in Stimson Pharmaceuticals.
Yeah, I don't think they did.
Okay. Well, there you go.
Yeah. Now, that was impressive too, but what I find interesting is, again, anything Adirond's touches, sadly, when it comes to regenerative medicine, turns to shit.
That's right.
So anytime, if we see a press release that Adirond somehow gets the rights to this, in my view, it's over.
Yeah, exactly.
That's
not kiss of death.
That's not going to happen. This guy, Michael Young he's a real player. So, that's impressive to me, and I think that there's a real possibility this is going to be something we're going to have in our arsenal. And I hope it's not 2031. I hope it is 2030. I hope it is in the next 5 years. Maybe I'll get to keep my hair till I die, or what's left of it.
Could be. We'll see.
Anyway, so I don't think I was too pessimistic. I think I was a little optimistic today.
No, you balanced it well.
All right.
You balanced it well. Good job.
888-659-3727. Let's see who this is. Hey, you're on the air. Who's this and where are you calling from?
Hey, this is Kenny from New York.
Kenny from New York.
What's up, Kenny from New York?
What's up?
Hey, just calling in just because I've been a long-time listener. I've called the show before a few years ago, I think. I was the one who called about the Merck switching to Organon. I was kind of freaking out because I thought it was a new company.
Yeah, you freaked me out. I remember the call.
You freaked out Spencer.
I did.
I'll always remember that call.
Yeah.
That was a good one.
No, it freaked me out because, I've been taking Propecia now. I started to lose my hair about a month before my 21st birthday. And I got on the drug because I was a little nervous at first. I got on it probably like 2 or 3 years after I first started noticing. I've been on it now for a little over 10 years. I'm 30, going to be 34 this year. I've been lucky enough, knock on wood, I've kept, nothing has really changed over the past 10 plus years. So
that's great.
I've been grateful for that.
Mm-hmm. Yeah, that's incredible.
Knock on wood and everything. But more recently, I've been looking at my hairline a little bit on the left side. And, it just could be a little bit of a phase or shedding or something. But because my hair loss is mostly at the temple areas, which sucks because I always feel like, it frames your face.
Yeah.
So for me, it's detrimental to keep every hair on that hairline. It's very, but I've been taking name brand Propecia.
It's detrimental to lose your hair. You mean it's imperative that you keep every hair in that area.
Right.
Yeah.
Right. Yeah.
I don't mean to correct you, but I just want to make sure people know what you're talking about.
No, I appreciate it. I'm probably just a little nervous. That's why I'm not using the correct terms. But more recently I've been looking at my hairline, and not much has changed over the course of almost 12 or 13 years since I first started noticing. But I take name brand Propecia, and I've been thinking about maybe if I were to go to Proscar, it would be 1.25 in quarters, and maybe that little extra would help with, keeping the hair longer, or I don't know what you think about that.
You never know, man. You know, I mean, we're not physicians. I am a believer in, I've been doing intermittent therapy for a while. I'm a believer in titrating the medication. I upped my intermittent therapy as far as the instead of taking the drug once per week, I'm now taking it about every fourth day, every fifth day. I still like 1 week I'll take it every fifth day, 1 week I'll take every fourth day. I mean, I really titrate slowly. I've lost ground over the years. I have some retrograde alopecia now, just overall thinner all around. When I blow dry, it's really not that noticeable. It's noticeable to me. But when my hair's wet, it's ridiculous compared to what it was just a decade ago. Maybe even 5 years ago. I don't know. I wasn't watching it that closely. But in general, the male pattern baldness aspect of things, the androgenetic aspect of things, hasn't really progressed that much. So when you get to a certain age, you're not there yet. It's kind of you have two things going on. You have senescent alopecia, where the hair follicles are essentially just not growing as robustly as before, and you're not getting the same hair shaft diameter, and you're fighting it with the DHT blocker, your androgenetic alopecia. For me, I did feel, even though I'm older, that changing my dosage, titrating it just a little bit, has helped. So while I know my hair loss isn't fully dependent on DHT anymore, just lowering it a little bit gave me a little bit of a boost. So that was a long way of saying you probably have nothing to lose.
Okay. So when you're saying that, because I thought DHT was the main factor that would cause hair loss.
No, it's one of the main factors that we've been able to identify that triggers and causes the miniaturization of hair follicles in male pattern hair loss, androgenetic alopecia. However, there's a lot of different factors. There's inflammatory issues, and there's just age, period. So as you get older,
senile alopecia.
Yeah, or senescent alopecia, or aged alopecia. So you'll see guys who've had full head of hair, you think, for their entire lives. I think Richard Gere is a great example. I mean, he's old as dust now. He's 75 years old. And he's maintained the integrity of his hairline. He's got no significant bald spots like on his crown, but he has an overall thinner hair where you can see his scalp, even though his hair is white. And that is not male pattern hair loss. That's senescent alopecia. So this is a guy that was not affected by DHT hair loss.
So all that is the way that, I mean, what's going on with that, what it's describing is the hair shafts themselves, like all over, or it could be isolated in specific areas, but it's usually more of a generalized issue. Is where the hair follicles reduce in diameter. They become finer. So they're not falling out per se any more than they would normally during the anagen-telogen growth cycles, but they're finer overall. So that in and of itself creates, when it gets to a certain threshold, a visual difference that you can see and feel, like when you're running your hands through your hair. So it's a very gradual process for most people. Like I don't have senescent alopecia, but I have retrograde. I've had that since I don't remember when I first noticed it, but I had it in my early 30s, even when I had my my first transplant or repair transplant with Dr. Wong. But those are additional issues other than hormonal or DHT sensitivity, as Spencer was saying. So it's, we don't know what's going to affect you in the long run, but DHT sensitivity is the primary factor, at least in the first half of your life.
Sorry to fuck you up, man, but the future's not bright.
Right.
Weren't we just talking about how to break bad news to people earlier?
No, but honestly, man, I mean, if you said you're 34 now.
Yeah, I'm going to be 34.
Yeah, I mean, you're doing really well on the drug. I mean, you may not even deal with any type of retrograde or senescent alopecia until you're in your 60s, you know? So, I mean, you may not even live that long. Who knows what's going to happen tomorrow? So you're doing well.
Yeah. No,
So
I appreciate it.
It's Friday.
Just,
go get a fifth of scotch and enjoy your life.
Yeah, every day is a good day. That's it. You have hair in your head and you feel comfortable in your own skin right now. One of the biggest problems as a hair loss sufferer that we all deal with is we're worried about the future. It puts us in a different mindset. Now, a lot of people who have anxiety in general worry about the future. It's pretty common. But as a hair loss sufferer, you're like, it really puts you, that future is in the crosshairs. You're not enjoying the hair you have on your head today in general. Most people aren't. I mean, that goes for me as well. I'm looking at it, I'm like, oh man, now I got to cut it shorter in the back. It's just not growing long. It's wispy. I could see, it comes out to the sides more. It's not as full. The sides of my hair, which I've always maintained like really thick hair, that's going to some degree. But listen, it could take 10 years. Why not enjoy what I have right now? And that's why I drink.
Right, exactly. That's why I go to bars and drink.
Yeah.
Right. Well, because like the Proscar too, it's also a little bit cheaper. When I first was going to get on the drug, the doctor at the time that I had didn't feel comfortable prescribing Proscar, so he only felt comfortable prescribing Propecia at 1 milligram.
And that's so stupid.
So I've just been
I
taking
mean, no disrespect to your doctor, but that's just stupid. It's the same. I mean, it's the same exact medication, and.
Right.
I understand. I understand. Back in the day, it's like, oh well, it's not cleared or it's not approved for hair loss. It's for prostate medication. But they don't understand the background on it, that it is the same medication.
No, it's also legal.
Difference in the dosage.
It's also legal to prescribe things off label for whatever.
Yeah.
So I mean, this guy had no liability. Maybe he thought you were just going to down the entire pill like a dope, like I did, and he just didn't want to deal with that. He wanted to stick by the book.
Yeah, this was a while ago. So this was like 2015, and I don't see this doctor anymore. I have a different doctor who said that he'd be comfortable prescribing me Proscar. He had no issue with that.
Yeah.
But my thing is, I've been taking 1 milligram Propecia for so long, and I've been able, knock on wood, to keep what I've had since I first started noticing it. I just hate messing with things.
So then why even talk about it? Why are we even having this conversation? You already know the answer.
Well, because I've recently felt like I might be receding a little bit on the left temple, and I might want a little boost.
What would happen? It's unlikely because they're manufactured in the same place, but what would happen if, for some reason, changing your dosage threw you into a telogen effluvium, even if it's temporary? How would you feel about that?
Temporary? I think I would be okay. I don't think I really went through. I mean, I might have went through a little bit of a shed when I first got on the drug, but I knew that it was going to be temporary already, because I've been on the drug now for over 10 years.
Yeah.
So. And I didn't get on it right away. I followed Joe's advice, and I did like Monday, once a week on Monday for 4 weeks, and then the following month twice a week, Monday, Wednesday, and then by the third month I was doing 3 pills a week, and then after that it was every day. But more recently, I think also, like, I was also pretty sick like a few weeks ago, so that might have contributed a little bit to it.
Listen, I'm not saying that I would be overly concerned about switching. It's the same medication.
Yeah.
But
it's also cheaper too.
But that's up to you. I mean, I'm not a physician. I can't give you medical advice based on everything I know. Yeah. As long as you're taking brand, there's no reason. Theoretically, there's no reason that you're going to go through an issue or you're going to have diminished results. Sometimes titrating does help. Like I said, I think it helped in my case. I mean,
Yeah.
17-year-old kids on Instagram don't think so, but everyone else does. So I'm not
Right.
bitter. So, you know, I mean, I think you're on the right track. It's nice that you have a doctor now that's at least willing to prescribe it in case you do decide to take it. You know, and you said that you started to get the prescriptions around 2015. That was really the height of the post-finasteride syndrome, like the push, the campaign. So doctors were starting to freak out. They weren't sure about prescribing the drug. They didn't know what was up. So in a way, I kind of understand.
Yeah. Yeah. Well, at the time, I was reading a lot of things, but because I always look things up before I act on them. And I did read a lot of the things, but also read the amount of study that was done when the drug came out.
Yeah.
So I just figured, for me, I was just gonna give it a shot, and yeah.
Mm-hmm. Look, I honestly believe that there's a level of social contagion when it comes to the adverse effects, especially the long-term permanent adverse effects of this drug. That is not to diminish anybody's actual experiences. But the truth is, from 1992 until 2005, this was not talked about in the urology conferences. Guys were taking 5 milligrams, and this was not talked about in the hair loss world at all. Did not exist. Now, we did come to find out years later that there were a couple of participants in the initial study for Merck who did have to get off the drug, and they did complain about persistent adverse side effects for a short period of time, and then they weren't followed. It was like 2 patients, if I recall. So, I guess because they stopped or they left the trial, Merck didn't have to report it. I don't know if that's true or not. That was a no-no. However, it was still a very minimal amount compared to what's being reported or purported today as a percentage. So, I think people are doing themselves a disservice by not just looking at things critically and watching influencers jump around with their laser helmets saying that they're never going to get on finasteride because it does this and it does that. There was one that was done, our guy, Tom, who's now a trusted content creator, someone did a video essentially kind of calling him out on his use of finasteride, claiming that he's telling people, he's bashing people who are anti-finasteride, which isn't true. He's just telling the facts. So there's this whole, it's like, I don't know, it's like this bizarre religion. There's just like factions and different sides of this argument. And just like, dude, you take the medication or you don't take the medication. No one's forcing you to take any medication. So you made a good decision for yourself, obviously, being on it for 20 years or 10 years.
No, 10 years.
10 years. Yeah. And maintaining your hair. I mean, most of these kids are not going to be able to take advantage of that because they've been fear-mongered.
Mm-hmm.
Yeah. I mean, like my hair, it's obviously not as thick as it was when I probably was first on the drug, but it's still pretty.
It's a slow agonize. It turns it into a slow agonizing progression as opposed to a fast one. Essentially, you're just buying time.
Mm-hmm.
Now, for some people, you're buying decades of time. That's it. I started losing my hair at 21 years old. I am a 60-year-old gentleman at this point. Yeah,
that's wow.
So if I would not have gotten my hands on this medication, I would have been a full-blown Norwood, never coming back. I may have had multiple surgeries, or I may have, I don't know if I would have shaved my head by then. I mean, maybe 7 or 8 years in, I may have considered it. I don't know. I don't know if I would have. But I would have been in a much different position. That's all. No shaved head joke.
That much for sure.
Would you get on like TRT? Would you get on TRT or anything to make yourself jacked at least, or would you?
Now, dude, I already am jacked.
Yeah.
But would I get out? Would I want to be more jacked? I would like to be. Would I like to have better skin around my muscles that's not becoming crepey, like my lower abs? It's like, when did I have a child? I don't remember ever having a kid,
Stretch marks.
Yes, TRT would help me tremendously, and I would look super fit if I was able to do that. I see these guys like the vascular necks at my age, and you see them in the gym, and they have a lot of vascularity and just hardness to their muscles that you can't have naturally. And I love when people say, "Oh, I'm just taking, it's anti-aging. I'm taking TRT." Listen, brother, you're on gear. There's nothing wrong with it. Just admit it. You're taking gear, but I can't take it because it's really a fine line when it comes to your hair.
Yeah, I know. That's the thing. Because I'll see it in the gym too. These guys who are just ripped, and you can just tell right away. Because there isn't any way a vein pops out that much out of somebody's skin. It's just.
It can't. When I was really young and I was training hard for a short period of my life, when I was into it, when you're like 21 years old, those veins do pop out. 27 maybe, but after a while, it doesn't. And the skin just changes, man. I mean, my skin is completely different. It's not horrendous by any means. I feel very fortunate, but TRT would reverse a lot of that.
Yeah.
Little testosterone, brother. But then you stop producing it yourself, so I don't know if I'm ready for that either. Huh. Guys don't understand that. People just think, yes, hormonal replacement is great. I think it may have a greater benefit for women when they're going through menopause. But anyway, I'm going on a tangent. But would I take it? I won't take it now. If I decide to take it at some point, if I really need it, then I'm going to have to come to terms with the fact that I may end up losing hair. I may trigger significant hair loss. I may kind of pick up where I was when I was dealing in my early 20s.
Yeah. No, because that is a definite issue with getting on it.
It's the largest new segment of hair loss sufferers that doctors are seeing today. There's a whole surge now of old guys. You could have told me to take it off the camera, Joe. There's a whole surge of old guys now, my age, who are being prescribed TRT or think they need TRT, and they're losing their hair, and it's happening rapidly. So that's a whole new segment for the hair transplant market.
Yeah.
And these are guys who weren't really losing their hair before. Their male pattern baldness was very slow. It wasn't severely triggered. And then at 50 years old or whatever age they start TRT, they're off to the races.
And they're freaking out.
They're freaking the F out because they never dealt with it before. They thought they got past it. They may have a slight recessed hairline or a little thinning on the top, but they figure, that's age related. They still look good. They have a mature hairline. And they want to get extra jacked, or they want to perform better in the bedroom, but they don't want to take the real steps it takes, like diet, changing their sleep, health, and all that stuff that could really help improve that stuff. And, TRT now is essentially part of the fabric of our culture. If you're past 40 years old and not on TRT, you're becoming an anomaly.
That's crazy.
Yeah.
Really. It's that common.
It's that common.
Jeez.
Do you actually see like electronic billboards here in Los Angeles for TRT? And you think these doctors know what the hell they're injecting into you? It's a one-size-fits-all protocol. They put you on this thing. They charge you by there's systems that charge you by the month, on your credit card. You can even get prescribed online now.
No, that's crazy because you don't know where it's coming from. It's interesting too. Like my girlfriend and I, we walked past this. It's like a salon, but they offer Botox injections at this hair salon.
Oh, yeah.
We were shocked because, like, you don't know where they're sourcing this from.
And you can buy counterfeit Botox on eBay and on different sites. I'm not sure if you can get it on Alibaba, but I mean, there's all kinds of shit being injected in people. It's insane. And who's injecting the Botox? Do they have a nurse practitioner in the back of a hair salon?
I guess so. Or maybe it could just. I don't even think there's really qualifications for it. I think they just offer. It might even just be a course, a one-time course, maybe. I don't know.
Well, you're supposed to have some sort of medical credentials. You need to be a nurse practitioner, an RN, a physician. I'm pretty sure that a physician's maybe a PA can do it. But just like these people that go to like Bryman and take your blood pressure at the doctor's office, they're not supposed to be injecting.
Yeah.
They're not supposed to be injecting any of these fillers or Botox into you. It's not within their scope of practice, in quotes. So, yeah. I mean, I see stuff all the time, man. I saw a hair salon that does tooth whitening, which is a little better than Botox, but
gosh.
still.
Yeah. Wow.
Dude, and the suckers you see online, I just put up a video on my Instagram, and it's sad, but I think it's important that people see this. And these guys in different parts of the world getting like really bad scalp tattoos, and these women who are getting some of the worst microblading and eyebrow tattoos you've ever seen. It's just freakish, man. And it's happening en masse all over the world. It's even happening here in Los Angeles. I've seen some pretty well-heeled women here in LA, like in Beverly Hills, who've gone for microblading. It never ends well. By the time they need a second microblading session, their eyebrows, it looks like hell. And these are people that have money.
Well, what is that microblading? That's just...
Essentially, it's like a tattoo. They use a blade to create what is supposed to look like an eyebrow fiber, a hair fiber, in the shape of an eyebrow hair. And it's kind of like they cut the person's skin and insert this ink into it.
Oh, my gosh.
And so they have permanent eyebrows. And, maybe one pass it could look okay. In some cases, 2 passes it could look okay if you go to somebody really good. But usually it never ends well. It's a bad idea to microblade and tattoo. All cosmetic tattooing, unless it's for like maybe vitiligo or something that, you're dealing with either a defect or, like that autoimmune condition like I was talking about. That could be a benefit, a lot of benefit to people. But it has to be very specific cases, like if you have vitiligo on your nipple or whatever. Anyway, I'm going off on a tangent. Here's the bottom line is, almost everything you see out there, not just in the hair world, is complete bullshit. If it's attached to aesthetics, most of it is bullshit.
Yeah.
That's the way it is. Now, the whole mantra in plastic and cosmetic surgery is, we're so glad that we're getting away from the overfilled look and, women want to look more natural. That's not a trend, buddy. That's because they finally realize that this stuff is disfiguring people permanently. It never leaves your body. So doctors are backing off of it now and claiming it's a trend to look more natural. So don't trust anybody. That's the bottom line.
No, definitely, yeah. Okay.
All right, brother. Listen, you're in good shape. I'm glad you found the doctor who's willing to prescribe you Proscar if you want to switch. I'm a fan of titrating the medication if you feel like you're losing ground, but you got to make sure. You don't want to make any moves prematurely.
Yeah, when you say titrating the medicine, like, what is it? You just take one pill a week, or do it?
That's a transition from one frequency of dosage to another. Like you were doing when I was explaining the once a week for a month, then twice a week for a month, and 3 times a week for a month. That's titration.
Yeah. Oh, I see. So do like 1 milligram one day, 1.5 another day, like that kind of thing? Or...
Well, you could do that if you wanted to do that. Sure.
Yeah.
Basically, some way that you feel comfortable moving up to a higher dosage over a gradual period of time. Not just jumping into it immediately, but take your time. Like if you feel comfortable doing it 1.25 on Monday, then 1 on Tuesday, then 1.25 on Wednesday, then back to. If that's the way you feel about it, try it. Or you could introduce it more slowly, like when you originally started on Propecia, per my guidance, is stick with the 1 milligram, and then once a week do the 1.25 for a month, and then the second month do it twice a week. Say Mondays and Thursdays you can do the 1.25, and the other days you're doing the 1 milligram. Month 3, Monday, Wednesday, Friday, with your Tuesdays and Thursdays, and then Saturday, Sunday being the 1 milligram, and just keep moving it up like that.
All right, brother. Listen, we're going to take another call, but good luck.
Okay.
It's always good hearing from you.
Thanks for calling.
Right, great. Thanks again, guys.
Good luck, man. Take care.
You. Have a good
Thanks
night.
for calling. Bye-bye.
Bye.
888-659-3727 phone lines are open. We do have a couple of calls on the line. Joe, you wandered off like Biden for a moment. You just got up and left.
I need to do some coke. I was tired, so I need to.
But normally, like you say, change the camera. Take me off the camera. You just got up, looked around like you're going to shake some invisible guy's hand, and walked away.
I did. I run the replay. I did say switch the camera. You just didn't hear me.
Oh,
I might not have said it very loud either because I'm actually sick. I didn't mention that before we went on air, and I'm really tired. So
I'm sorry to hear that.
Maybe I did. That's okay. You can't hear my voice. I'm kind of raspy my voice.
I just find it very sexy. I don't know.
Well, you and everyone else, my God, the messages I'm getting. But
you are a sexy man, Tillman. 888-659-3727. Let's see who this is. Hey, you're on the air. Who's this and where are you calling from? Hey, caller.
Hello. Caller.
We'll give you a second because you've been holding on for like 10 minutes.
They went to the bathroom.
All right, got to hang up. Guys, 888-659-3727 lines are open. Feel free to call in. We're here to provide you with anything and everything hair loss. Again, back to PP405. Look, it's great. There's a lot of people online who are able to kind of regurgitate the information that's out there. I'm glad Joe actually read it because I think that's more important than, I think that's more beneficial in many cases than someone trying to read all these studies, remember the information, and then present it in a lucid way that you're going to understand, but there may be some sort of a little bit of bias when it comes to the way they present it in order to get clicks and stuff like that. Joe just read it straight. I do have a certain bias. I do think that this is something that out of all the products that are out there, out of all the potential treatments that are out there, based on the success of this one guy who's actually brought something to market in a manner that most researchers never do, I think there's hope here.
Yep.
So
something's coming.
Yeah. Guys, you want to call us? We'll take a call. Otherwise, Joe's not feeling well. So
it's the consequence of doing yard work in the windy rain. Shouldn't have done that. I exerted myself in the cold weather.
What do you think happened? You think you don't get a virus from the windy rain? You don't get a bacteria in general?
But my immune system was compromised from the physical effort and the chilled temperatures. So it lowered the wall for something to come in. Had a sore throat. John kind of worked in my chest.
Johnny Fox, you are more than welcome for the false hope. It's what we try to do here at The Bald Truth. 888-659-3727. We're live doing our broadcast that we do every Friday, or most Fridays.
Most Fridays.
Because we try to help you guys. We try to give you information for free. I spoke to a woman last night. Very nice woman. She told me some interesting experiences. I'm not going to get too into it because I don't know if she would want me to. I mean, nothing serious, but I will say that PRP is absolutely the biggest money grab in this industry, and it's one of the first things that these, especially women, are sold. Mm-hmm. And when I discussed whether or not or how long it took for the PRP to be prepared and all this stuff. She said literally minutes, just a few minutes. And it's just like, all right, well, you didn't get PRP, or at least real PRP.
No.
At minimum, even if the measurements aren't taken, the platelet measurements aren't taken, it's going to take 15 to 20 minutes to produce that before they re-inject into your scalp.
Yeah.
It's amazing. It's amazing to me.
Like, there's a drawer of blood, put it in a centrifuge, and spun it for a few minutes and shot it back in.
It's possible. It may not have even separated the platelets, the top.
Yeah.
It's possible they just spun it up, a few minutes, put it back in a syringe. Let's go. That'll be $1,000. Thank you.
It's such a, like, people don't know what can happen by just casually getting needles stuck in your arm for for a discount, right?
Oh, yeah.
Because you mentioned a coupon code. Like, I don't remember coupon codes including injecting air bubbles into your system.
People have no effing clue. Now, usually when they're drawing blood, you're not going to have, they don't have to really aspirate if you're drawing the blood. So, getting the PRP done or getting PRF done, that's, but once it's put back in, well, it depends. If it's put back in intravenously, it's already in your system.
Yeah.
But yeah, I mean, there's so many dangers that these people have no idea about. And also there's people that have used, there was one thing that came out in the news not too long ago. It was like one med spa. 3 women got HIV from, I don't want to get sued for this because this is a trademark, but it's a PRP process that women are using for their face. It's called something very specific, named after
named after a horror character.
Absolutely, yeah.
Yeah.
And they got HIV.
Yeah.
That shit happens, man. Let's see who this is. Hey, you're on the air. Who's this? By the way, Joe's frozen, but he's able to hear you.
Again. Jesus.
What's up, caller?
Joe's frozen. Oh, okay. All right. Well, this is Gypsy from LA.
Gypsy, what's happening, brother?
So.
How are you? Still smoking? Did you quit yet?
You know it. Do you have to ask that question? Come on.
Well, listen, I'm worried about you. That's all. I'm not judging.
I appreciate it. No. And you know what? Even if you did, it's okay to judge.
Dude, I love cigarettes. I love cigarettes. Now, I don't smoke them because I know how much I love them. Because I can't do it. But if I get really loaded and someone has a cigarette, I'll have one.
Well,
but I also don't get loaded much.
Make sure you don't run into the in Beverly Hills, because then that will happen.
Well, I'm sure if I run into you in Beverly Hills, you will be outside bullshitting, and you're going to pull out your cigarettes and get me drunk.
Yeah.
So what's going on, brother?
Well, I miss you guys. I haven't called you guys in a little while. I've been terribly busy. I just, it was funny that the subject of the show today, because I had seen that post not too long ago, and I'm like, okay, here we go. I honestly think that the quote unquote cure, it's only going to come out of like gene editing or, if we ever do get cloning right. Everything else, I think the reality of things is everything that we do is a coping mechanism, And
I don't disagree. I mean, I do think that gene editing is going to be huge. And I also think that AI is going to play a major role, So we may be closer than we think, but it may not be this PP405 that does it. My only interest in it really is that there's a real player involved and that Google got involved, I think, based on the reality that this guy's already brought a multi-billion-dollar drug to market.
I got 3 words for you. CRISPR.
Yeah.
Yes.
Yeah.
That's the future.
Yeah.
CRISPR.
Is that 3 words?
I agree.
No. That's me being funny. That's actually a part of next week's show that I'm working on. So stay tuned.
So
watch next week's episode.
So are we just going to hear your voice from the rest of the show, or
what happened?
Well, the side by side, your camera's gone,
That's
brother.
strange. I see it on my end.
And I just decided to put the camera on myself, which I think maybe people appreciate.
Weird.
I don't know.
Let's see. Hold on. Just
so what else is up, brother?
Not much. I just recently experienced. I don't know if that was everywhere, but I had real trouble like getting a hold of Proscar. Actually, it was a little bit of a struggle for me.
There was definitely it was back ordered for a while, for a couple of months actually. But
it was, right?
Yeah,
but that's what I thought.
Yeah, and it really had to do with a supply chain issue. Everyone was freaking out because they thought that the EU was going to ban the drug and all this happy horse shit, which I knew wasn't going to happen. But there was a supply issue, and people were unable to get it. Now, I always keep more in stock.
Yeah.
Just in case, because you never know with any medication, especially when it comes to brand name, if there's going to be a supply line issue.
Well, I'm learning from your fine example. That's what I'm starting doing now. It's because the way my prescription is written is basically as if I'm taking the 5 milligram, every day.
Daily, right?
So my refills come a lot quicker.
Yeah, so you need to get those refills every time you're able to do it. Don't wait. A lot of people who do what you do, they'll wait a long time until they need it.
Mm-hmm.
You want to stock up on it.
Yeah, well, I actually ran out for a few days, maybe for about a week or so. And I just kind of had to get my hands on generic, so to speak. I actually ordered from Happy Hip.
Okay.
And then I'm like, well, at least I have like a bottle of generic there just for emergency.
Yeah.
But yeah, it was interesting.
Dude, it was harrowing for so many people. I wasn't happy about it. I actually took the time to call the pharmaceutical company, told them, obviously, who I was, this is the information. We're getting a lot of, concern through the American Hair Loss Association about the product. Are you choosing to discontinue the product, or is there just a supply chain issue? And they assured me that it was a supply chain issue, and they gave me the date of when it was going to be back in on the West Coast, and they were right.
Oh, okay. Hey, one question in regards to medication, because I was looking into after was it last week when Joe shared the results with the oral minoxidil, finasteride combination. Yeah. So after that, from what I've been able to piece together is that Lontin is still available outside of the U.S., but in the U.S. It's no longer available.
That's right.
Is that what it is? They manufacture it here and then they just sell it all over the world, but not here.
Well, the brand name is no longer available here, and I think the brand name may be manufactured in. Where's it manufactured? Do you know, Joe? I think it's Europe.
I don't know, but Graham in Australia, whose results I was showing, he's actually taking Loniton name brand.
Yeah, because
I just don't know where it's made.
I started looking like everybody else, just online pharmacies, and I noticed that there's a Canadian pharmacy who sells it, and I'm like, well, I wonder if I can order it from the States and get it from Canada, but
it's actually made in Canada.
Well, what's interesting is that we've always had the ability, and I don't know if anything's changed, to get pharmaceuticals from Canadian pharmacies shipped without issue to the U.S. I don't know if anything's changed, but that was always kind of a big thing.
Okay.
Yeah, it's made by Pfizer Canada. Interesting.
Well, like I said, it's made here in the little U.S.
On the 51st state.
Yeah, there you go.
Good
so
stuff.
maybe I should try that and report back to you guys and see if I'm able to get it that way, right?
you probably will be able to get it that way. And
I should start a service.
Yeah.
There you go.
Joe's minoxidil. Joe's legit.
Joe's drugs.
Joe's legit drugs.
Yeah. I like that. JLD.
Yeah.
.com.
Yeah.
Another question. I don't know if you guys. Yeah, I think you guys might have talked about this, but I've heard that also vitamin D is important in regards to like.
Mm-hmm. It's extremely important. There's
results with the medication.
a study conducted by Dr. Sharon Keene. I think it was published in the Hair Transplant Forum International, which honestly is just a trade paper, but it was a real in-clinic study that showed it was both men and women, if I remember correctly. But essentially, someone who came in initially with a very low vitamin D level, she upped their vitamin D level to pretty high levels. I think it was like 50 to 60 or maybe up to 70, I forget. But anyway, this person essentially stopped their hair loss and regrew a lot of hair just from vitamin D. So there's definitely, we do know for sure now that low vitamin D levels, which is it's rampant, it's an epidemic, is definitely associated with the faster progression of male and female pattern hair loss.
Okay. So remember when I was saying before that it seemed like my, response to Proscar and minoxidil seemed to have waned or maybe even lost a little ground.
Yeah.
I recently had a physical.
Yeah.
And Joe, you might want to record this because it's a soundbite. I'm almost 50 for God's sake, right? But the results, everything was great. I even asked my doctor. I said, "Hey, just out of curiosity, I know it's not probably the right test, or I didn't specify it how it's supposed to be, but I'm like, can you just check my testosterone levels?" And he was like, "Well, you're getting close to 50. I can give you a prescription for the pill." I'm like, "Nah, there's no problem there. I just yeah." He told me that, and I'm like, "It's not because of that." I said, "It's I just wanted because to have a baseline and what have you." So that came out actually pretty good. I'm at 643.
Oh wow.
Right.
Not bad for a guy who's almost 50.
Yeah, that's what I said. And of course, he forgot why I asked for the test. And when I come back, he's like, "Yeah, you're 643. So if it doesn't work, it's psychosomatic." I'm like, "No, it was for the hair, doctor."
Yeah.
But the one thing that came out, everything else came out.
But you had low vitamin D.
For my age. Yes.
Yeah.
Yeah.
Well, smoking completely zaps your vitamin D and your B vitamins as well.
Really?
Yeah.
Okay.
Mm-hmm. So I'm curious. What was your vitamin D level?
I can look it up. I don't have it in front of me, but it will take me to log into the. But he gave me a prescription for 50,000.
Oh shit! So your vitamin D level must have been super low, brother. Like 10.
Yeah. So it was in the red. It was in the red. So he said, take this for 90 days, once a week, and then we'll do new labs.
Okay. Yeah, that can really, not only does it make you significantly more prone to other diseases, it definitely affects your hair.
Okay.
So I'm glad you went. I'm glad you went to have a physical, and you're on prescription vitamin D, because that could really. I mean, essentially, it's a hormone. That could really change things for you.
Mm-hmm. Well, what he told me, and I don't know, he's more like an old school type of doctor, but he's like, you should always take a vitamin D supplement. It's like this whole thing about getting out in the sun, making out, and there's different types, and yada, yada, yada. And he's like, you should always have a supplement of vitamin D.
I agree. Okay. I think now even it's more difficult to get vitamin D from the sun, even here in Los Angeles, because we're at a latitude where only during certain months, and really you have to be in the sun like at 12 noon or around that, when it's really high noon, to get the conversion for your body to make your own vitamin D, which helps with NO and all that stuff. So I believe in it. Yeah. A good D3 supplement could really benefit you.
No, and what's more for me is I don't spend a lot of time out there, in the sun, because I usually work from home or the office, or I'm driving. So like my exposure to the sun, even if I wanted to climb that, I have no grounds to climb that. So
yeah.
I'm like, okay, well.
I'm glad we're going to take some more calls, but I'm glad that you had that check. That's major. So if you think you're not doing as well on finasteride now, I can almost guarantee, and I'm not a doctor, that once you get your vitamin D levels up to something that's reasonable and not what they consider within the normal range, you want to try to get it within maybe 50 or 60 range. And if you can do that, and you will, and maintain that, I think you're going to be much better off, on several levels, but definitely with your hair.
Okay, that sounds good. Because, I was about to make an appointment with Dr. Benham. I know that's a 2-month wait, but still I was like, well, I've been in this enough. Maybe it's time to go and have a consultation and maybe see what he says.
You can. Tell him that you're a regular. Tell him you're a regular caller of the Bald Truth, and you don't want to wait 2 months. I'm just kidding. But you can tell them. see if they put you in. So right. You'll talk about the consultation on the show.
Yeah, that's true, right? But you know what? There's no problem waiting. All
right.
But
he's a great guy. But now that he's one of the few really good guys in this field. I can tell you that. Mm-hmm. And I just never forget our Atlanta friend goofing on him at one point when he did, Dr. Benham did this great promo for the Global Hair Loss Summit. Do you remember that, Joe?
Vaguely.
Yeah, I was just
There's so many instances.
I was like, man, you are such a piece of shit. Anyway.
You're a bad man. You're a bad man. All right, guys. Well,
Sean Benz, he's a great guy, kind.
A bad man.
There you go.
Bad man, serious.
That's the best, man. That's classic. All right, brother. Listen, thanks for the call. Good luck. I'm glad you got a checkup.
Thank you, guys. Thank you. And it was a pleasure talking to you guys again.
Always a pleasure talking to you, brother.
Good hearing from you.
Take care. Bye-bye.
Take care.
All right. Bye-bye.
888-659-3727. I mean, he may be really surprised when he gets his vitamin D levels to at least a reasonable level.
What do you say the boost was to 40,000?
Well, he didn't say what it was. He didn't say what his levels were, but he was given
But what the
prescriptions are usually 50,000 once a week.
Wow.
To get you up to normal levels. It takes a while. I mean, it's fat soluble. It takes, but once you get there, you can start taking supplements. Mm-hmm. Let's see who this is. Hey, you're on the air. Who's this, and where are you calling from?
Hi, this is Neil from Boston.
Neil, how are
Neil.
you, brother?
Hi, I just want to kind of give my comments on the PP405 drug.
I don't know if we're ready for them. Go ahead.
Oh, okay. I've been following hair loss research for the last 5 years, and I've been burned too many times to just have blind faith. I don't care.
Welcome to the club, brother. Welcome to the club.
I remember Kintor being a disappointment, and HMI like 115 being a disappointment. Denson going, I don't know.
Brother, you've been in the game for 5 years. We can name you 100 products.
They've been in this exact same spot before they went poof.
Yeah.
It disappeared.
Yep. But, I follow a lot of the research from this channel, this new YouTube channel. His name is KWRX. Have you heard of him?
I haven't.
No. He's got tons of like research papers that he goes over extensively, and he's actually even done interviews with Kintor, I think. And I actually think he's basically Kevin Mann, but less militant and a lot more precise in like the research. Like Kevin Mann gives you like kind of like a surface level basic stuff, but this guy will actually go into great depth over the research papers, and it's actually pretty good.
There are guys out there who are really good at that. They're able to take this information, distill it down, create a very lucid presentation, and get a lot of interest. And I think there's merit to that. I think that could really, give people some solace, make them feel like they're more knowledgeable about what the potential treatments are, so on and so forth. It's unfortunate though that even the best in those cases, usually, what they gain is viewership. Maybe they gain a little bit of, I would say most of them have, a lot of these guys have good, good intentions and have integrity, but it never really amounts to much as far as anything coming to the table. And a lot of people just end up wasting their time commenting, getting involved with these guys. But good for him. Listen, I may start watching him. Who knows? I may learn something.
He was actually the guy. Yeah, he was the guy who was the first person to point out that what is it called? SAMI RNA. I forgot what it was called. Cosmerina. Is that what it was? Cosmi RNA or something like that.
Yeah.
He was the first person to point out that was all BS. The very first guy, and it started making the rounds on Reddit and all the hair loss forums, and then people started to think, oh, yeah, he's making some valid points here. I don't think this actually works. So
yeah, I'm pretty sure, we discussed it as, anything that is going to come to market as a cosmeceutical is a no-go. There's a reason for that.
Yeah.
So, yeah.
Was there ever any definitive evidence one way or the other about what Cosmo RNA was doing as far as results? Like, did anyone come forward with photos saying I used it for a year? Because it's been out for a year at least.
Yeah. I
What's his name? KWRX?
KWRX, yeah.
Yeah, this looks interesting. Yeah. I like watching this shit, and there's a lot of people. Listen, I give credit to people who are able to absorb this information, put it out there again in a way that's entertaining and interesting, keeps people's attention. I don't have the patience for it. So for me to watch something like this with somebody else putting in the effort, I'm good with it.
Yeah, I usually just listen to him while I'm working or something, just to, hear what any news or whatever. He goes over a lot of like a wide variety of different treatments, and he'll either say, "Oh, there's no way this is going to work," or he doesn't see the point in this drug, or he'll say, it might be promising. Like, he very rarely says, "Oh, this is actually going to this could really work," or something.
But he is booking non-medical consultations. So that's interesting. So.
Oh, I didn't know about that.
Yeah. So,
one-on-one. And he says this is not for medical advice. But he's got a Discord.
Listen, maybe he's able to.
Yeah, I'm on his Discord.
Listen, he could also be a type of guy that it could benefit people. I don't know. I haven't watched a single video, but it could benefit people just to be able to talk to somebody who's able to tell them, look, based on all the information that I have, this is nonsense. Don't waste your time or your money. And that could save people a lot of pain. So, he may offer a valuable service. I have no idea.
He charges $60.
Yeah,
Kyle B.
for that.
Yeah, you know what? I've gotten to the point now where initially that would always rub me the wrong way, but now I realize there are some people in this game who are figuring out a way to make money, who might be providing solace, an ear, the ability to talk to somebody. What turns me off most are the guys that are really obviously they're working for hair transplant surgeons. They're getting kickbacks and shit like that from doctors, doing online consultations and leveraging their YouTube channels and shit like that. That is not something I love. This looks different. So 5 years, you're 5 years in the game. You realize everything's bullshit. You found this guy. He's telling you everything's bullshit too. So we're all on the same page.
Yeah. Just don't want to get my hopes up. I mean, if it happens,
keep on trucking.
Great. Yeah.
Yeah, exactly. Anything happens. See, that's the position I've had for like the past 20 years now. Because so long ago, I was never really into this to begin with, because of my early experiences with the industry. I just didn't believe it really from the beginning. But it's always been a position of mine. When it happens, and no amount of listening to people talking about it, no amount of reading research papers, no amount of waiting for the next hype to be spoken about will it actually ever change anything. Like it doesn't mean anything. Yep. What I'm talking about with a PP405, what I'm talking about next week, or what anyone else is talking about, it means absolutely nothing until we see definitive evidence, visual evidence of a before and after, and we know that it's safe, and we know that it's going to be here in less than 5 years, 5 times removed. I mean, it needs to be something that is tangible, and we can look forward to it in the near future. Not this, not the 37th mouse that's got 5 hairs growing on his ass.
Well, my biggest issue
to something
is
10 years from now.
People are spending so much time kind of holding off. They're not getting on medication, or they're basically holding off on making a decision because they believe something better is coming down the road, or even worse, they're making bad decisions, jumping into surgery, believing that if things don't work out for them, or if things diminish quickly, there's going to be something that's going to help them. So they might as well take a chance now. And that's all based on all the stuff that we're talking about now. All the guys that are spending a lot of time talking about this, the Reddits and the forums and all that happy horse shit. So it could be damaging. But if you just want to watch it for entertainment and interest, if it's something that really interests you, without getting your hopes up, I don't see anything wrong with it. I just don't have the patience to do it myself. When I first started in this game, that's what I did for a while. Like the first year I was on the air. And I was like, you know what? This is bullshit. My first show, we were talking about hair cloning and Dr. Cohen Go, which I don't know if you know about him. You've only been in the game for 5 years. But we were talking about a lot of things that were being discussed online on the old school message forums. We're still in the same position. Finasteride, minoxidil. Now we have oral minoxidil that's being prescribed heavily. Hair transplant surgery, which is devolved, not evolved. It's gotten worse.
Yeah.
Over the years.
Yeah.
So that's it. That's what we got.
Yep.
In other words,
Kevin, man.
same story.
It's the same story.
What's that?
2025.
Yeah, I was going to say credit to Kevin Mann, because after all of his episodes on research and whatever, he always stresses at the end, it doesn't mean you can just sit and wait and not take finasteride. You have to get on that now.
Yeah.
So what happened? He's no longer doing his thing. I heard
back.
rumors.
He's back.
No, he's back.
What happened?
His channel was down for 3 weeks, and I was actually watching. I actually found out today he was back on. I don't know what triggered it, but I thought, what's going on with his channel right now? So I typed it in. Go ahead.
Yeah, I think it was like a copyright thing or something. Like
that's right.
Like someone claimed that he did.
Someone claimed copyright infringement or trademark infringement, and And what's weird about that? Here's what's weird about that. When YouTube gives you a warning, they don't just take your channel down. Like it has to be something really egregious. It can't just be, it's a copyright violation or anything like that. And I know that because I've had those.
the amount of
using
complaints
on
that
some
he
of my
must get,
videos.
there must be, I mean, I can't even imagine the campaigns that are run against this guy from these post-finasteride syndrome dudes.
There are people who don't like him.
Yeah.
Yeah.
There are a lot of people who he's made a lot of enemies on Trustless, on the PFS Foundation, and there's even a video he released today where there was an article that was attacking him by I can't remember what it was about, but it was about how he's saying that there are no side effects to finasteride, and he basically rebutted it by saying, "No, I acknowledge there are side effects. I just think that they're blown out of proportion." Because people think that, you take the drug, then you're going to get PFS. Because he's been very against this idea that PFS is a real thing. And I don't know if it is or not, but he doesn't believe that. But a lot of people get sensitive about that, and they attack him, and they try to take him down. And they've tried to take him down, this is the third time his channel's been taken down, I think, by YouTube, because there are just a lot of enemies that he has.
People try to cancel me before cancel culture ever existed. So, I mean, put it this way. He must be doing something right. I don't spend enough time watching him. I've heard about him. I've watched a couple of videos. He seems, I think he has a very unique way of presenting, and it's compelling. Look, I'm on the pro-finasteride bandwagon. I've been talking about it for 30 years, and I've been taking it for 30 years. So, I got to pay more attention to all these guys. I really should. I just don't. But
I don't have the time.
Yeah, I owe Kevin a lot, because he was the one who got me to start taking the drug. Because at first I was worried about the side effects, and if it weren't for him, then I would never have gotten on it, and I probably would have worse hair than
I think that's great.
I do now.
Well, here to Kevin Mann and everything he's doing. It's nice to know that he's back on the air, and unfortunately, I don't watch him. I really should, because he is in the hair game. That's what he talks about. This is my space, but I kind of live my life differently now. I'm just I do the show. I'm dealing with the back end of things, and I try not to get too involved in the online world if I don't have to. It could become very stressful and kind of all consuming,
I never noticed that.
All right, brother. You want to add anything else, or that's it?
I could comment about what I think of CRISPR, but I'll leave that to Joe for next week.
Who?
The CRISPR.
About who?
I did look at the...
Oh, CRISPR, the gene editing. Yeah.
Yeah. I'll leave that for next week.
All right, brother.
Okay.
All right, good luck. Thanks for the call.
Right. Thank you.
Take care. Bye-bye.
See it.
Bye.
It's an amazing kind of space now, the whole hair loss space, and who's kind of jockeying and getting in position. And, you see some guys were kind of developing pretty quickly on the YouTube space who seem to be kind of be dropping off. And it's the guys, I think, that are really providing, I'm not going to say 100% solid information because I don't know, but, interesting information, presenting it in an interesting way, not selling anything in the end. These are the guys that people really gravitate towards for the long term and seem to get the most respect in the end. I don't know, does this guy Kevin sell anything?
I don't think so. I don't know, but I've never seen. I don't watch him really either. Like you said, I've seen a couple of videos. Maybe he does, but I've never seen or noticed any sort of reference
maybe he's able to make
links or coupon codes.
Yeah, maybe he's able to make money off of YouTube, which is great. So that's why people have so much respect for the guy. I don't even know how old he is. I know he's pretty young.
It looks like he's probably late 30s, maybe.
Yeah. I'm going to watch. Kevin, if you're listening, I'm going to watch. Maybe I'll make a comment or two. But I think it's interesting. I like, a guy that has so much resolve and that has been taking so much shit and actually been taken down from YouTube a few times, and he has resilience. I admire that. I know what it's like.
Yeah.
You know? I mean, I had huge sponsors that were being threatened by, these national chain clinics.
Yeah.
I mean, it was insane. I never forget Brad Wolf, who's the former president of the ISHRS, tells me that Matt Levitt, who ran and owned Medical Hair Restoration, which at the time was like Bosley Jr., turned around in a meeting to him and said, "Your boy Kobren's finished. We're having his sponsors pulled." And that one phone call, all that did was make me think, okay, if that's going to happen, what do I do? And I went from being on 2 channels to 27 channels, 27 stations across the nation within a month. I just called up these radio stations, told them what I was doing. I was able to sell that time, and I self-syndicated basically overnight. So I want to thank Matt Levitt for that. He literally changed my life. He made like a little project where I was making money from the book and I was doing okay on the radio show, but I was only in 2 markets. He made a relatively just a labor of love into a thriving situation for me because he threatened to have my sponsors pulled. And thanks Brad Wolf for letting me know. And what's funny about these doctors, they all think, everyone keeps secrets and they can talk amongst themselves. I know everything. Just think the bulbs.
Yeah, the bulbs.
For years.
Oh, hey, we got...
they thought this was private. Yeah.
Yeah, they all thought it was private.
Yeah.
I have so many emails from the bulbs. It's amazing. Dr. Bevan Boy Rule is in the chat. Good to see you, Doc. He says he'd love to think that gene editing would be the answer for male pattern hair loss, but it's likely polygenic, not just related to androgen receptor genes. There's more than 300 genes have been identified through, although many probably are irrelevant. Probably many genes still unknown. Yeah?
Yeah, for sure.
Yeah, look, we're just scratching the surface on this.
But who knows what AI is going to be able to do?
Yeah, and that's what I'm excited about. Like I've been diving into AI regarding other subjects, but yeah, the way that this can look at the hair loss issue, forget it. I mean, once a quantum computer gets a hold of this project, we will have a cure in 6 months.
Dude, I got this new ride, which I've shown you, and I'm trying to figure out the whole hybrid gas. It's a very powerful kind of sports sedan, and I'm like, wow, the range just keeps dropping like crazy. What's happening? You put the electricity in it, then you put the gas in. I don't know. I don't understand how the computer works. Sales guy can't even help me really. He's like, maybe you want to bring it in, whatever it is, and so I decide to confer with AI.
Mm-hmm.
Makes total sense. I drive like a maniac, first of all. Mm-hmm. The system needs to adjust to my driving habits. And basically just explain things point by point, stuff that you just can't find online. And even your sales guy, you probably have to bring it into service, have them check it out, and then they would explain it to you.
Yeah.
But it was just amazing, and it was put together in a very easily understandable way. And then it's like, would you like me to create a PDF for your glove compartment, or something like that?
Yeah.
It's like, all right.
Yeah, it's amazing.
Can you laminate it? So
yeah, exactly.
Anyway, it's pretty cool. All right, guys, listen, we're going to call it a night. I want to thank everybody for hanging out, tuning in. I may or may not go over to Instagram and do a live. I'll see.
We'll see.
I got nowhere to go tonight because I'm on this 5-day situation that I told you about.
Oh, that's right.
I'm not really eating dinner. So I can't drink.
Oh, it's no alcohol. Oh, okay. Wow. It's tough, man.
See that? To me, not being able to have dinner is tough. To you, no alcohol is that's the deal breaker.
I didn't say it was a deal breaker. I just said it was tough.
All right, brother. Good show. Guys, I want to thank everyone for hanging out tonight. Check out Joe's Instagram at Joe Tillman Official.
Mm-hmm.
I have a
like this video.
Yeah, I have a Substack now. I'm going to be writing extensively on PP405 for you guys to kind of better understand what we discussed today. I think I'm going to do an article on that. I just thought of it. I'm going to do that. But I've already posted, I think, 2 or 3 articles. The Substack is growing. Don't know how because I'm not really promoting it, but do me a favor. Subscribe to it. Share the information with people who are interested in this stuff. It's free. I'm not charging anybody anything. Yet. No, I'm not charging anybody anything.
That's the Patreon.
And and we're providing, and I think I'm providing some really solid, kind of nuanced information on subjects that, they're out there. You guys are talking about them on Reddit and everywhere else, but you're not necessarily getting all the facts. I'm trying to bring that to you. So that's the bald, The Bald Truth on Substack. Do me a favor, subscribe. I want to see my subscriber lights or notifications come on right now. So that would be cool. Nothing yet. Thanks, guys. That's The Bald Truth on Substack. Check it out. What are you waiting for, Joe? You look antsy. You got to go to the bathroom?
No. Okay. I've already done that.
Okay. Check me out on Instagram at Spencer Kobren. Until next time, be strong. God bless. Thank you so much for listening. Take care.
Thank you very much. I'm sorry for any inconvenience you may have been put to prior to the program, and I'm glad you enjoyed it. And if you could now leave by the exits at the rear, that'd be splendid. Thank you.